There was a recent publication from our team regarding the use of pomalidomide and SL-401, which is a plasmacytoid dendritic cell targeting antibody, which is going into early studies. And I appreciated you asking me about that because the data there show that that's a safe approach and very active. It's been the practical application of it, and why we're kind of very interested in it is targeting plasmacytoid dendritic cells may have a role in the setting of immune therapies, including CAR-T, because we're realizing that when CAR-T fails a patient, there are various things that happen. And one of them appears to be a very pivotal role from these types of cells. These plasmacytoid dendritic cells appear to have a role in relapse. So one can think, theoretically at least, about strategies combining SL-401 with immunomodulatory drugs and being able to take that forward as a strategy between immune treatments. But obviously our primary role with our work was, is this a safe platform to develop? We showed that it was active. The question now is, how would we then take it forward?